thank you, Rosie, for the great information. And I would like to really welcome Dr. JORDI Rodriguez. He's from
Thank you.
Spain, Barcelona, and as we know, he's from Mutual, right? Terrassa University Hospital.
Yeah.
Okay.
Very good.
Okay. And today we will talk as a webinar. Okay, Q&A. So today we will just a fireside chat, just talk, discussion, round table, and of course, today all of the participants, they are onco-gyne. Is Dr. Bandit, Professor Bandit. He's my mentor. He taught me. I was the resident.
Thank you.
And he will send an email to you because he's very interested in Haifu, and I gave your email to him to
perfect, no problem.
And Dr. Olarik, she is also the very famous onco-gyne in Thailand, and Dr. Manop is the same. He's an onco-gyne and he do the infertility too. So, and I think today we will have a lot of the experience on about the discussion about Haifu and gynecology. So, and I think for the first question, maybe please talk about what is the ultrasound gyne Haifu. So, can you give the short introduction about it?
Yeah, I don't know if you want, because probably if I have a short presentation, if so you please, want, please. I don't know. Probably I can answer so much questions about this technology with my presentation. If it's, finally you have some doubts, I can answer more questions wherever you want. If you want, do you want a short presentation first?
Yes.
And yes.
Yes.
Okay.
Yes. Just 5 or 10 minutes.
Oh, okay. Sorry. Here. Yes. Vista compartir. Sorry. Compartir pantalla. Okay. Here.
I cannot see yet.
Yeah, no.
Okay, it's coming. Great.
Okay. Okay, the uterine fibroid, you know, it's not important. You know, all of you are gynecologists or in relation with this pathology. It's a very common pathology in women. Okay, it's very important to point out that of course there is enough evidence about their negative impact on fertility of the fibroids. And okay, although the surgery has a significant complication rate, sometimes major complications, myomectomy is still considered the gold standard for women who want to preserve the uterus. Okay, but we have another technologies, another techniques, surgery, radiofrequency ablation, of course, and ultrasound guided Haifu. Okay, but what is Haifu? How does it work? And what can it offer our patients? Okay, this is surely many of you know that Hypo is a non-invasive technique for conservative treatment of solid tumors. It was approved in 2004 by FDA, and in 2019 by the NICE, the British NICE, approved Hypo technique and published a medical guidance on ultrasound-guided Hypo. And in the same year, very important, SG Working Group on Non-Surgical Ablative Therapy of Benign Uterine Disease was created, of which our Haifu unit play an active role. Okay, and nowadays over 128,000 women has treated with Haifu technology. Okay, but the therapeutic principles of this technique are really simple, but at the same time amazing. The effect is very similar to that produced by a magnifying glass when it concentrates the sun's rays, okay? Therefore, HIFU produces ultrasound waves that pass through the skin and adjacent tissues and are focalized to necrose a deep localized tumor, okay? In this technique, the focal spot is guided by real-time ultrasound imaging. Okay, and this is the effect. The safety of the treatment is based on its great precision to treat tumors, okay? You can see in the video. This is supported by several studies of pathological anatomy that demonstrate a coagulative necrosis with clear and sharp boundary between dead and live cells, okay? You can see in the video, no lesions in the hand of this doctor, okay? And of course, this is the procedure, okay? The patient lies prone on a movable HIFU table with abdominal skin in contact with cold degazed water. HIFU treatment is performed under intravenous conscious sedation to reduce discomfort and to have a continuous feedback with the patient. This is very important. On the right, the video clip is played in fast motion, of course. You can see that we make an ultrasound scan from the sagittal view during different sections with 5 millimeter separation. And we start to treat the deepest area, okay, the deepest area of the fibroid, okay? At the beginning, we treat the deepest area of the fibroid, applying 1 to 3 seconds energy exposures, separated by 2 to 4 seconds between the shots, okay? The decision to stop the treatment is made according to the intraoperative grayscale sonographic changes. You can see this image, the whole fibroid with hyperechogenic changes, okay, indicating a complete ablation of the fibroid, okay? Another way to evaluate the efficacy of the treatment is by contrast enhanced ultrasound, sonoview, okay, during treatment, and or contrast enhanced MRI, okay, after treatment. In both cases, you can see a non-perfused volume of 100% in this case, okay? And of course, okay, as you already know, after HIFU treatment, the fibroid will progressively shrink and the patient will present different degrees of clinical improvement, so that the follow-up consists of performing an ultrasound or MRI at 3, 6, and 12 months and annually to calculate the volume reduction of fibroids and at the same time examine the symptom severity score with a specific questionnaire, okay? And this is our experience. Probably you have you want to have information about this. Well, as you in this case, in our series, 14 years of experience, we have treated a total of 862 patients, okay? 18% of patients were treated in 2 or 3 sessions. It's not important, but only in 52 cases, 52 patients, the treatment was not achieved due to different problems, such as pain, intestinal gas, or air in the bladder, and poor visualization due to obesity and other factors, okay? Among the treatments completed, all of these, 94%, okay, 68% were successful and 32 required a surgical procedure, okay, hysterectomy or myomectomy. And the mean age of the patients treated was 41 years, okay. In 68% of patients, the main symptom was hypermenorrhea. The mean fibroid volume was significantly higher than that of most series, 163 centimeters cubic centimeters, average maximum diameter of 7 centimeters. The mean non-perfused volume of our series, 60%. Sorry, 60% because we included all the patients, including the learning curve and all the difficult cases, 10 fibroids more than 10 centimeters, okay? And in the last 5 years, we are selecting cases to improve our results, okay? And this is our non-perfused volume. And okay, it's very important to point out that there are different factors to achieve the success of the treatment. Of all these factors, the most relevant is the type of fibroid, okay? The type of fibroid is very important to know before the treatment. This is Funak's classification, okay? Fibroid type 1, fibroid type 2, fibroid type 3, depending on T2 MRI signal intensity comparing with the skeletal muscle and the myometrium. Type 1 and type 2 fibroids are hypointense or isointense and have a good response to Hypo, okay? On the contrary, type 3 fibroids are hyperintense, and the response is much worse, okay? And the other factor, very important, the other factor to consider related to the fibroid is the rate of vascularization, okay? And this is evaluated on contrast-enhanced T1 MRI, also before HIFU treatment. You can see the different response between high vascularization fibroid here at the top. Look at the small non-perfused volume, and a low or medium vascularization fibroids here. In this other case, this patient has two different fibroids with a low or medium vascularization with a very good response, okay? And definitely the overall results of our series show a decrease in the volume of the fibroids. After 12 months, the mean volume shrinkage of the fibroids was 50%, reaching 67% at 5 years, okay? And in parallel, the symptom severity and quality of life scores were reduced more than 20 points, which has been identified as discriminator of clinical healing. And okay, this is some of our complications, not so important. We have only 2 severe complications, and the other are 7% of minor complications, okay? No bowel or bladder injury, no amenorrhea after HIFU. And okay, if we compare, this is our 7.1% of minor complication and only 0.4 major complication. If we compare with other treatments, it's very impressive, the difference, okay? In our case with HIFU technology, all the treatments are ambulatory surgeries, okay? And in relation to fertility, HIFU safely and effectively achieve ablation of uterine fibroids without damaging the surrounding myometrium. HIFU also preserve ovarian and endometrial function. We have some studies that show no significant differences between the anti-Mullerian hormone levels before and after treatment. And in this other prospective study from 2020 of Melkozerova et al., okay, observed no significant changes in molecular and tissue markers of endometrial receptivity in women undergoing HIFU ablation for uterine fibroids. Okay, so the objectives of HIFU ablation of uterine fibroids in women with gestational desire are, on the one hand, to achieve the inactivation of the hormonal and vascular function of fibroids, okay, very important. On the other hand, of course, to shrink the fibroids in order to normalize the uterine anatomy. Logically, this second objective is especially important in submucosal fibroids, okay? But both things seek to increase the chances of obtaining a safe pregnancy without the complications of surgery. Okay, we have several publications with good pregnancy outcomes after HIFU, large series with high gestation rates, and our experience is not so much different from all these publications. In our retrospective study, we include 560 women with symptomatic uterine fibroids who underwent ultrasound-guided HIFU between 2008 and 2018. This is our recent publication. And okay, 71 pregnancies of 55 patients have been obtained, which is, to our knowledge, the longest series of pregnancy after HIFU treatment in a Western country, okay? The pregnancy rate was 34%, which is, okay, is not bad if we compare it with other treatments, okay? And among the 71 pregnancies, there were 43 successful deliveries, including a natural twin gestation, with an incidence of cesarean section of 43%, which was much lower than in patients undergoing myomectomy, you can see here, and much lower than in patients undergoing uterine artery embolization or in those reported by other authors after ultrasound-guided HIFU. Okay, the rate of preterm delivery was 9%, only 4 cases, which is lower than in series of pregnancies with untreated fibroids or in pregnancies following uterine artery embolization. The mean birth weight of the 44 newborns was 3 kilograms. 7 of them were low birth weight infants, these that you can see here, okay? And except for the 1.4 kilogram baby who was born with a previously diagnosed tetralogy of Fallot and intrauterine growth restriction, the remaining newborns, 98%, developed well without complications during postpartum and breastfeeding. Okay, these are few complications detected during pregnancy. When preterm labor, okay, 2 cases of placenta previa and 2 cases of preterm premature rupture of membranes. And during delivery, 2 cases of emergency cesarean section due to hemorrhage associated with placenta previa, and for fetal bradycardia in other case. 3 retained placenta with manual removal in 1 case, and okay, but no uterine ruptures and no cases of placenta accreta, very important. And the results were achieved in women with a medium maximum diameter of treated fibroids of 7.4 centimeters and a non-perfused volume ratio of 76%, which is higher than that reported in most series of HIFU treatment. These are some of the cases we have treated. There are some cases and examples. A submucosal fibroid, you can see here, Fibroid Type 0, okay, all the fibroid occupying the whole cavity. Okay, after HIFU, the fibroid completely disappeared 6 months later here, and with a good pregnancy results, okay, 2 babies. This is another case, subserosal pedunculated fibroid, Fibroid Type 7, you can see here. On the right, this is a MRI after HIFU. Okay, completely ablated. And this is a transmural fibroid successfully treated with HIFU and with a hysteroscopic resection of the remaining myoma fragment 6 months later, okay? 10 centimeters, HIFU, 2 centimeters, hysteroscopic resection, okay? And this is the result. The whole cavity is completely normal. And okay, this woman became pregnant spontaneously 3 months later after this hysteroscopy. And so much cases, okay? This is a polymyomatosis case with fibroids of different locations in the same patient. The submucosal fibroid that you can see here completely disappeared 8 months later, okay? And just at that moment, the patient underwent a successful in vitro fertilization and got a full-term pregnancy, okay, that finally in election cesarean section, okay, because of breech presentation. Okay, this is another bulky fibroid, more than 10 centimeters, completely ablated. And conclusions, okay, is very effective HIFU technology and safe for uterine fibroids. Women undergoing ultrasound-guided HIFU, okay, can achieve pregnancies with few intrapartum or postpartum complications. And due to its non-invasive nature, it seems to be the first therapeutic option in women with decision desire. And of course, we need more and more and more prospective randomized studies to confirm these observations. And okay, this is all of I have to say of my presentation. It's a short presentation, and if you have some questions, no problem.
Yes, this is very.
This photo is because of as you can see the concentration and focus of energy in order to destroy is many years old. As you can see here, Archimedes is a war, Romans against Greeks, okay? But its medical application has come to us with ultrasound guide HIFU technique, okay? Let's not let time pass. let's take advantage of it, is my opinion. Okay.
Thank you for your talk. So Professor Bandit, so what do you think about the HIFU? I think you have some experience from Chongqing.
I think it takes time a lot to treat one case of patient for one procedure of HIFU. So I would like to know if we have that HIFU or bought HIFU from Chongqing, then how many patients that we can treat per day for myoma or endometriosis on average?
How many patients per day?
Per day.
Yeah. We have only one device in our hospital, okay? But if we treat on the morning and on the afternoon, it's possible to treat 4 cases, depending on the cases, okay? Okay, difficult cases with a 10 centimeter fibroid is of course, we can treat 3 cases, for example, in one day, okay? But if the cases are not so difficult, we can treat 4 cases per day, okay? Yes. But in our hospital, the problem is that our device, we only treat with this machine only in the morning, only 2 days per week, okay? That's because our series is only, okay, we have treated, we have done 1,000 treatments in that moment, okay? But it's around 800, 900 patients in that moment, okay? But we only treat 2 days per week. Only in the morning is very difficult. But all the day, 4 treatments, 5 treatments, okay.
When did you think that it's worthwhile, or you can get the money back from you pay for buying one HIFU machine, and after how many years or after how many patients that you think that it's worth?
Sorry, how many years or how many patients?
How many patients or how many years you can say both? In terms
board. Okay.
You can get the money back from you pay.
The learning curve. Okay. Are you? Yes. Probably. If you treat, for example, if you want to a hospital like Chongqing Hospital or Suining Hospital, in these centers they treat every day. If you want to these centers, probably in 3 weeks you are with a lot of experience to treat these difficult cases. Okay, probably 3 weeks is enough to treat alone with. Okay, yes, probably 3 weeks is the learning curve. Probably, yeah.
I mean about the cost benefits or the cost effectiveness, something like that.
Yes, we don't have studies about this, but in the literature there are so much studies that compare surgery and ultrasound guided HIFU, and okay, the conclusion is HIFU is with a good cost effective treatment. Okay, because because it's outpatient procedure. Okay, no cost. The cost is only the machine, probably the machine. Okay, the anesthesis, the nurse, and some no expensive material of the yes fungible treat material, but the cost is the machine, because no another costs of because the patients are not in the hospital during 3 days. Okay, and okay, probably the technology is a few expenses, but finally it's cost effective. Okay, yes, if we compare with surgery, definitely yes.
So I have the question that the first time that you bought this machine is not cheap, right? And you have other procedure, you can do the surgery, right? You can do the laparoscope. So why you choose the HIFU
Yes,
to treat the patient? Is 10
because
years ago, right?
Yeah, the patients day by day, the patients want to resolve the problem without damage. Okay. Years and years ago, all the patients underwent open surgery. You know the history. After this, laparoscopic, robotic, and probably radiofrequency ablation with only one punction. But the patients wants to a non-invasive treatment, no surgeries, no scars, no complications. Okay, and day by day, patient doesn't want a surgery. Okay, it's because the patient, because the interest of the patient. But okay, because of this, our first option to treat a woman with gestational desire and with fibroids is HIFU. First option. Okay. After this, we study the case. We study this case, and we do ultrasound image. And okay, if it's a good case for HIFU technique, we do HIFU. If it's not a good case because this woman have some limitations, or the case have some limitations, obesity, uterus very in retroverse utero, very big fibroid of 15 centimeters, or polymyomatosis, very difficult cases, and it's not a case for HIFU. Okay, surgery, the second option. Okay, but if it's a good case, an optimal case, we do HIFU at the first. Yeah.
Okay, great. So, JORDI, can you stop sharing your screen that we can see your face bigger?
Yeah, sorry.
Okay. And how about you, Dr. Manop? Do you have any questions? You are also the oncogyne and you also do the IVF.
Yes. Thank you, Dr. Olarik, Dr. JORDI. Okay.
Yeah.
Thank you for nice presentation. Quite very good experience. So may I ask some question that for myoma, yes, we may consider it the first, but do we need to make sure that it's not right to be the cancer or something?
Sorry, cancer?
Yeah, I mean, do we need to check it first that, okay, make sure that it's not turn to be the cancer, or it not look like a leiomyosarcoma, something, before the treatment by HIFU? Yeah.
The concerns about sarcoma and fibroid. Yes. This is your question. Yes. Sorry. It's a very good question. We don't have, a test with a very high sensitivity or specificity to diagnose sarcoma before HIFU. We don't have. The best is MRI. Okay. And we do MRI all the patients. Fortunately, the incidence of sarcoma is very low. Okay, 0.1% here. Okay, but the most important thing is to do an MRI. Sometimes we can diagnose sarcoma before HIFU. Okay, but if we don't do the diagnosis and finally we do HIFU treatment, the most important thing is the follow-up. It's very important to do a strict follow-up, 1 month, 3 months, 6 months, because of if the treatment failure is a failure treatment, okay, the fibroid, the supposed fibroid, doesn't shrink, and the symptoms persist. And finally, okay, if the patient has 40 years, more than 40 years, okay, we have to operate very fast, okay, and we had no problems with the sarcoma. We have only 3 cases of sarcoma, okay, because we only have treat 900 patients, okay, 3 cases of sarcoma with no problem. in 2 cases, the diagnosis, we do the diagnosis before HIFU, okay? And the other case, we do HIFU, and okay, in 1 month, patients doesn't improve symptoms, and finally, okay, we operate, and unfortunately, it was a sarcoma, but with no metastasis, with a sarcoma localized in the pelvis, and no problems. But okay, this is a concern, and okay, carefully with these cases, and the most important, MRI before HIFU and strict follow-up. Okay, strict follow-up after HIFU treatment. Yeah.
Thank you.
Thank you. Thank you. Okay, I have the questions. So, how about the adenomyosis?
Yeah. I think it's a very good treatment for adenomyosis. Okay, I'm going to be honest. We cannot resolve all the cases of adenomyosis, but it's very important that we can treat adenomyosis, focal adenomyosis, and diffuse adenomyosis with different degrees of symptoms improvement, okay? But it's very difficult to resolve completely forever and ever, because it's a pathology depending of the hormones, and okay, previous menopause is very difficult to resolve forever and ever, okay? But we can repeat this type of treatments, okay? And yeah, and the problem in our area here in Spain, here in Terrassa, is the patients are with a very high obesity. The BMI is very high typically in this group of patients. I don't know why, but the last year I tried to do HIFU in these cases, and it's a very problem in our area, because 80% of women have obesity, and when I put these patients in the machine, it's very difficult to see, and if we cannot see, we cannot treat with security. But it's different in China, because the obesity is not the same, and they have a very good results with HIFU. It's impressive. Okay, but sometimes, including in China centers, they need to do HIFU, GnRH analogs before HIFU and after HIFU, and finally DIU, levonorgestrel DIU, this intrauterine dispositif, yeah, hormonal dispositif, yeah, and together, okay, they have a better results compared with HIFU alone, okay, because it's very difficult pathology. Yes, it's different than fibroids, but it's a very good treatment to prove. Yeah.
Okay. In your experience, do you work collaborate with the IVF doctor before doing the HIFU?
Collaborative with
the IVF doctor, infertile doctor.
Yeah. With centers, not in our center, because we don't have a fertility unit. We don't have, but yes, but in clinic with Dr. Carmona.
Yes.
Clinic hospital, in São Paulo hospital, in Valle Hebron, Belviche, in big centers with FIV centers. We are with collaborative. Yes, we collaborate with these centers, because it's very important in this group of patients. In the moment we have treated with HIFU, and the fibroid shrink, it's very important to do the IF very fast and determine, yes, because of the age of the patients, 35 years. Okay, we cannot, and the collaboration is very important with these centers. Yes.
I see. Wow, wow. This is so. How about radio frequency? That I read your article. This is your article, right? Okay. Okay.
Yeah.
Okay. You said that okay. Radio frequency is good, but it maybe can you compare between RF and HIFU? What is the pro and con?
In sterility patients, yeah. Okay, in radiofrequency ablation, there is no so much publications about yes, pregnancy outcomes after radiofrequency. In China, some, but not so much publications. We don't have so much evidence. Okay, for me, radiofrequency ablation is limited to a specific type of uterus or type of fibroid. Maximum of 5 centimeters, not over 5 centimeters. Okay, 1, 2, 3, 4 centimeters of fibroid is a very good case for radiofrequency ablation. Type 1, type 2, type 3. Okay, type FIGO type 1, type 2, and type 3. Okay, 4 centimeters, and no other cases for me. Okay, because subserosal fibroids is the risk of lesions is high risk of lesions, of intestinal lesion. I think is not indicated for submucosal fibroids. Okay. And is for this type of cases, compared to HIFU, we can treat practically all of the cases carefully with subserosal fibroids, okay, because we have bowels between the, okay, but okay, this is the difference. We have very good results with HIFU, very good pregnancy results after HIFU, but radiofrequency, I cannot respond to this question. I cannot answer this question because we don't have experience yet. More data.
Okay. So, and another question is, in your data, you show that some patient is not respond to HIFU. My question is, so when you do the operation of the case after the HIFU, are there any like more adhesion, bleeding or something? So what
okay. Yes, we operate 32% of cases. Okay, we operate a lot of okay, no adhesions. My experience is only my experience. Open surgery, laparoscopic surgery, sometimes hysteroscopic surgery. I have no seen adhesions in the uterus or in the bowel. Is my experience, no adhesions. And okay, the bleeding is similar during, okay, with an exception. If the HIFU treatment, we achieve ablation area of, for example, 60%, okay, is not enough to improve symptoms in some cases, and finally we operate these cases, but we, at the present, we achieve a 60% of ablation. In this case, sometimes the fibroid, the dissection, is not so much bleeding, okay? And a problem, as a little problem, is in some cases the capsula is a little with adhesion in the myometrium. The section plane between the myometrium and fibroid, okay, is so much difficult in some cases, but not outside the uterus, okay? But yes, sometimes the dissection is a little difficult, okay? But finally, we do, and no problem. Okay.
I see. Okay. And are there any questions? Dr. Manop and Dr. Veena. Now Dr. Veena, she's training in UK. Are there any patient in UK has the experience on the HIFU? Dr. Veena, can you share some experience?
Yeah, hi, thank you for your great talk. Yeah, unfortunately, we don't have the HIFU in UK yet. Yeah, so don't have experience to share. Yeah, thank you.
Okay.
Thank you very much.
Thank you. Thank you. So, Dr. Manop, do you have any questions?
Yes, please. After the HIFU treatment, how long that we could wait the patient to, I mean, after HIFU treatment and it worked, do we need to wait over 6 months to for let the patient to get pregnant, or longer, or before? Yes.
Nuevamente, it depends of the type of fibroid. Okay, but for example, submucosal fibroid, okay, type 0, type 1, type 2. Patient can try to get pregnant when the uterine cavity is completely normal. Okay. Yes. After HIFU, the submucosal fibroid will shrink. Okay. And with this shrinkage, the uterine cavity normalize the anatomy. Okay. In that moment, the patient can try to get pregnant. Okay. If the submucosal fibroid is 3 centimeters, for example, probably in 3 months, maximum 6 months, the uterus, the uterine anatomy is normal. Okay. And in other cases, with fibroid intramural subserosal, with no distortion of the cavity. Okay. In these cases, I think, I cannot prove, but I think that in this type of fibroids with no uterine distortion, patients can try to get pregnant practically immediately. Okay. It's not necessary to achieve a shrinkage, a very important shrinkage. It's not important. The important is the cavity, and this fibroid is inactivated because it's ablated. Okay. Infertile women have different mechanisms of infertility. The most important is the uterine distortion, but there are another mechanisms, hormonal mechanisms, blood supply. Okay. If the fibroid is intramural subserosal, the other factor after HIFU treatment, there is no the other problems, the other mechanisms. No hormonal changes, no blood supply, because it's ablated. Why we have to wait shrinkage? For me, it's not necessary. If the uterine cavity is normal, okay? In the submucosal fibroids, is different. This is my opinion, but there's no studies. Okay.
Okay. And
next, for the moment.
The question is, so how about the cystic lesion like endometrioma, chocolate cyst? Do you have the experience shooting the HIFU on the chocolate cyst?
No.
And so how about the focal adenomyoma? Do you have the experience?
No. Only adenomyosis, but not in ovarian endometriomas. No, I have not tried this. Okay, the chocolate is liquid. Well, okay. And the important is the capsula. For me, it's very difficult to ablate the capsula of the cyst, because immediately you are treating the follicles, the ovarian tissue, because it's very near to the capsula. For me, is not a possibility. It's not possible to treat with HIFU. I don't know if treating the center, the chocolate, and okay, increase the temperature in this all liquid. Okay, finally in the capsule, but I don't know. It's very difficult to answer this question. For me, it's not a treatment.
I see. And now we have less than 10 minutes. So Rosie, so how about your experience? Do you want to give some experience?
Actually, I will probably use the couple of minutes to reflect on the few questions that have been asked before, okay? And also, I think for all the doctors who participated in this webinar is all interested in about the learning curve, okay, about the training system, okay? So I think, so I'll talk about the training system, okay? So we have developed, first, okay, I'm Professor Rosie Xin. I'm in charge of the International Business Department of Chongqing Haifu Medical. So I myself is a researcher. I conduct cancer research, okay, but Haifu International Business is under my direction right now, okay. So in terms of the training system, okay, we have developed the international training system, and I'm happy to tell everyone that we're going to roll it out together with APAGE. So APAGE has also formed a Haifu working group, just like the ESG. Okay, so APAGE also formed the Haifu working group, okay. The International Society of Minimally Invasive and Non-Invasive Medicine is going to roll out the international training program of HIFU with APAGE, okay? And we already have the online component, which have 14 lectures. It's already released online, okay? So with the training system, we have already tested the training system in like a Hong Kong center, and also Dr. Silva in Malaysia, and also a Nigeria center, the centers who has been started the operation during the COVID-19, okay? And so with the new training system, now we know quite well the learning curve, okay? So with certified consultant, like OB-GYN consultant with minimal invasive surgery experience, okay, like laparoscopic surgery, it takes about around 40 cases, okay, for you to become, you can operate independent on the simple cases, okay.
40
cases, yeah.
40, yeah.
Now we know, okay, yeah, it's about
for 3 weeks in Sweden, 40 cases, yeah, okay. I agree.
Yes, okay, and but as you know, this as any technology, okay, the learning curve of doctor is evolving, okay. So to complement the training, okay, program, okay, and we also mobilize our telemedicine service. Okay, so let's say a doctor has already learned the first stage of training. Okay, I mean, can independently operate, but going to encounter a difficult case, then you can call the telemedicine service ahead of time. Okay, so our doctors, our clinical team in Chongqing will, through the telemedicine service, support you to go through, okay, the operation. It just feels like someone is sitting beside you, okay? And why we can do this? Because this whole operation is it's based on the information, okay? So it's you know, so actually it's a 5G compatible, it's AI compatible, okay? Down the road, okay, we already JORDI, actually we already developed the MRI and the ultrasound fusion in treatment monitoring system. So for the doctors, new generation of doctors who learn this, it will be much easier for them because they are going to see the outline of the lesion and also the uterus by the MRI. Okay,
MRI, yeah.
And they see the dots, they see the HIFU knife. So in this way, it will help them to develop the 3D configure. Okay, much faster, and also during the treatment, they will know where they go. Of course, they based on the treatment planning. Okay, and another feature of the treatment of the training system is that we break down into 3 steps. Okay, step 1, step 2, step 3. So step 1 is a theoretical, and also include some case discussion. Okay, and step 2 is the on hands. Okay, so depending on if it is a training center we set up, we usually send our doctors on site to support the center for 3 months. So in 3 months, as JORDI says, okay, if you prepare enough cases, you'll be trained, fully certified during the 3 months. And we done that in the Nigerian center. We done with Dr. Silva. Okay, so, and if it's you don't have enough cases, no problem. We'll train you till you can use the telemedicine service. Okay, and then we can complete the training. Okay, afterwards. Okay, and you also have in the training program 1 month to come to China. So you can either use it up in the front so that you can pass the learning curve very fast, or you can actually save some of this time later on for the advanced training. Okay, so one word, the training system is ready. We tested it. Okay, and also it's going to be more in the multilingual language. Okay, so the English version and Chinese version is already online, but as we the Spanish version, the French version, and also the Russian. Okay, so as we develop the market, so this training system courses will also be given in the language of to fit the needs of the doctors from different language background. Okay, so this is one thing, and there's another question regarding the cost effectiveness of the business. I think the questions on the business side means how fast can a hospital, if invest in this technology, to recover? Okay. If so depending on the organizations, okay, for like a Mutigavong, called the hospital, it's a partially operation based interests, okay, and also it's mostly research based. So in this case, recovering the investment of the hospital is of a concern, but is not the entire objectives. Okay, like our centers set up in Germany, in Bonn, Frankfurt, and Oxford, it's almost completely research oriented. So therefore, it is not there to recover the investment. Is that okay? But our private centers, like we have 21 private centers in South Korea. Okay, and so these centers, yes, either the doctors bought it from their own pocket, or it's through the business model that developed with our business partners. But anyway, it's an investment. If it's an investment base, then we do calculate the ROI. So for now, we will not start a HIFU project if we cannot build the model so that the ROI will, the balance, okay, will be in three years. Okay, so therefore we develop the model and will tailor the business model towards the needs of the nature of the project. Okay, and another thing is that, of course, although OB/GYN field is the most mature field that we means this field is ready for this technology to be disseminated, because the guidelines there and in some parts of the country, the world, the reimbursement place there, whether it's under a national reimbursement or under commercial reimbursement. Okay, but we are also going to expand on the indications to including oncology. So I know today all the majority of the doctors who attend this session are the gynecologists. Okay, you wonder whether this technology will be applied for the oncology in OB/GYN oncology. Okay, the answer is definitely yes. Okay, but fibroids and adenomyosis are the learning curve for this technology. Okay, so we believe that when the OB/GYNs, when the specialists learn this technology, you will bring your bring it just like the laparoscopy surgery to expand the indication with your interest. Okay, so we already have doctors talk with us in the clinical trial setting or in the clinical study setting to see whether this can be used to treat the metastasis or ovarian metastasis, okay, like the abdominal wall metastasis, okay, and also even with cervical sarcoma. Okay, as JORDI knows why, okay, it's like a pregnancy was a contraindication for HIFU probably 8 years ago. But now it's the first choice for women with fertility desire, is it? So I think as the technology matures, as it becomes part of the standard of care, such as for fibroids, okay, or sooner will be for adenomyosis, okay, and I think there will be more indications, okay, be expanded even in the OB-GYN, okay.
Yes, endometriosis of abdominal wall, okay.
Yeah,
that's abdominal endometriosis, abdominal wall, and yes, ectopic pregnancy in the scar, in the cesarean scar, is another important. We have treated only 2 cases, but with very good results, and placenta accreta.
Yes. Okay.
We have treated only 1 case, but with a very good success.
And also we did not talk about here. There's another, okay, for who are interested in oncology, oncology, actually we have a small HIFU modality, which is for cervical cancer. So from hepatitis to HPV persistent infection to treat CN1, CN2 lesions, okay? And some center even expanded to treat the stage 1 cervical cancer, okay? So HIFU is already in this application, has already in this arena, okay? And so Olarik, these are some few things that I want to
it's not a few things, that's a lot.
Yeah.
and I recommend to do the training in Barcelona with Professor JORDI. I highly recommend. I went there and stay with him for a few days, but it's excellent experience because of it's not only the HIFU, because as we are the gynecologists, of course we have other options for the patient too. We can do the laparoscope, right? We can do the hysteroscope. So I think if you stay with Professor JORDI, you can learn for other perspective to treatment the patient. This is my idea. This is my idea. So
thank you.
So for the take-home message, JORDI, please send a take-home message for the audience.
The take-home take-home message is very clear, because you have said this, you have told now in that moment. It's very important. We have a woman, and this woman have different concerns about surgery and gestational desire, yes or no, invasive treatment, yes or no, because sometimes patients wants to, it's very difficult to, but sometimes they want to, yes, radical surgery. It's not, but okay, it's different depending of the patient, okay, and the goals of the patient. What do you want to what do you, ¿qué esperas? What do you wait for this treatment? You can answer to the patients. I want to get pregnant. Okay, this is an objective. No, I have 5 myomas, 5 fibroids, but only one symptom, hypermenorrhea. Okay, we can treat this fibroid, not the other fibroids. And it's very important, Olarik, you say, to have an overall and a general view of the problem. Not only HIFU treatment. No, the HIFU treatment is not good for all the cases ever and ever. It's very important. It's a very good treatment for most patients, but not for all the patients. And sometimes this treatment, failure. And okay, what can we offer to the patients? Was radiofrequency, laparoscopic, surgery, sometimes open surgery. Okay, there are some cases it's impossible to do by laparoscopic surgery to preserve the uterus. And it's very important to know what is the patient's objective, what they want. Okay, improve my symptoms. What symptoms? Pressure, hypermenorrhea, fertility is different. It's very different. And this is very important. And okay, my first option always will be HIFU. Why? Because it's very sure, very safe, very safe. Outpatient procedure with very low complications. And okay, it's the first option, okay? Because we don't, the comparative is very, we can compare with surgery, with radiofrequency, with uterine thrombolyzation, and okay, it's more and more safely treatment, okay? And it's my first option. And finally, if it's not a case for HIFU, we can test another treatments, okay? And it's very important, the MRI before HIFU, okay? When we are thinking about HIFU, okay, what type of fibroid? Where is the fibroid? Is posterior, anterior? During treatment, if the fibroid is posterior, patient can have pain in the back, okay, carefully. Conscious sedation, we can communicate feedback with the patient during treatment to avoid serious complications. And in this manner, is very sure, is very safe. And okay, is my opinion. We have, and we need more prospective randomized studies, okay, step by step, but I think is a very good technology, yes.
Thank you.
And so, the most important is to offer to the patient all the treatments, okay?
Okay.
Thank you, JORDI.
Thank you. Thanks a lot. And I wish to see you again face to face, maybe in Thailand, JORDI.
Perfect. Thank you very much. For me, it will be a pleasure for me to meet you again in Thailand. Perfect. It will be my first time.
Okay, sure. I will organize that. Okay. So
thank you, Larry. Please.
Thank you very much. So see you soon.
See you soon.
Adios.
Bye bye. Adios, Rosie. Bye bye.
Bye bye. Thank you. สวัสดีทุกท่านนะครับ สวัสดีครับแล้วพบกันใหม่ครับ
Thank you, Olarik. Yeah.
Thank you.
Please to
thank you.
Please to hear from you, Rosie, again. Thank you.
Yes.
Bye bye.
Together soon. Yeah. Bye.
See you soon. Bye bye.
ขอบคุณทุกท่านครับ สวัสดีครับ